This is early days, 20 some odd years ago now, but it still stands as, gold standard or science, which is still understood. And that is, there is zero safe levels of mercury in the human body. We can't get away from it. It's in our waterways, it's in our fish, it's in the air that we breathe. But we certainly don't have to add extra mercury to that toxic or burden. And so it's not safe, and we shouldn't be putting it in mouths. What I wanted to play, and what we're looking at here, of course, is neuronal activity, the nerve growth and dendritic growth in vitro, in Petri dish. This nerve is trying to find another nerve and communicate with it. It's obviously sped up from real time. But what's about to happen next is the addition of micro amounts, less than conceivable amounts, 10 to the negative 7 amounts of mercury. And this atrophy that's happening, denuded neural fibrils it's called, but that's it, that you're killing off that potential for connection. So in a person of adult size, this is happening, let alone in pediatrics. So speak to us, Dr. Yokoyama, about the harmful effects that we know about mercury and definitively now why we shouldn't be putting it in human mouths.
Okay, well, that kind of goes back to 2002. And I was, at that time, I called myself mercury-free. And that was rather
trailblazing for the time.
It was trailblazing for the time. And they wanted someone to represent that part of dentistry on the state board. So I volunteered, and somehow I got taken onto the board by the governor, appointed. And at that time, I tried to do a dental materials fact sheet that would reflect something like this. And this is Murray, Vimy, and Lorscheider. Yeah. And in fact, I've got Dr. Lorscheider to come to the board. And we did show these videos. It seemed like a slam dunk. I was so excited. I was there in Sacramento. I had all these things lined up, and I thought, okay, now we're going to make some real headway. And unfortunately, I was naive and young, and the board did not vote in my favor, and we did not put into the language of the dental materials fact sheet anything about pregnant women or children under the age of 6. Fast forward now to the FDA, and the FDA now has a warning for pregnant women and children under 6. And in fact, they went even further and said, well, women of childbearing age, you expect to have children? Well, we caution you, don't be getting mercury in your teeth. And a couple other high-risk categories, allergies, and people who have metal toxicities, things like that.
Right.
But the most important thing is that now it is finally being recognized. I thought in 2002 it was gonna be a slam dunk, but
well, with or without a nice little invitation, you're up against some big interest, right?
That's true.
And we're not going to get into the politics of it on this show, but Dr. Murray, you find, this has become part of your pediatric screen, right?
Mm-hmm.
Looking in the mouth. Of course, oral health, accounts for so much.
No, absolutely. Yeah. So, sort of standard procedure in my clinic, if a child is coming in with no matter what complaints, actually, there's looking at the gastrointestinal tract, the microbiome, through stool analysis. We can do a blood test depending on the age, just look at regular markers. And then we use hair analysis as a toxic metal screen, which is still one of the most reliable methods to see what's being accumulated in the body. So with that, we can actually open up view, is there a mercury problem? Is there another heavy metal problem? And then start taking the steps of detoxifying, supplementing, rebuilding, or supporting whatever organ has been hurt. So it really is a part of sort of integrative medicine, functional medicine. But, we can avoid so many of these problems if we don't put it in there in the first place.
Right.
That's the whole
thing. This notion of detoxification. There's something to that, obviously. We tout it all the time in our clinical practices. But the best way to manage toxicity is to avoid the toxin in the first place. And Dr. Murray, mercury is tip of the iceberg, but there's BPA, There's these other biohistocompatibility issues, but which is just fancy for like what is best matched to people. But besides BPA, what are the others that you're becoming more familiarized with now that we really shouldn't even resort to?
For filling material.
Yeah.
Well, I also avoid any fluoride releasing materials because there's a lot of those, especially in pediatric dental material.
Sure.
So we try to avoid those. We're really a bunch of the BPA precursors. Unfortunately, it says BPA-free, but once we cure it inside the mouth, it can become something that has BPA. So we have to be very careful of that as well. Just thinking overall, trying to avoid any sort of metal because there is, there are other, medical grade stainless steel options that don't have mercury, but we try to avoid those as much as we can as well.
Right.
And talking about that, like if there has been silver amalgam, mercury, fillings placed in somebody's mouth, whether a child or an adult, I think another important notion is, and this is where that smart certified dentist comes into being, is that there's actually a protocol for removing that safely, both for the patient and the dentist. Would you like to talk about that, Chad?
Sure. Smart Certified comes from the IAOMT, the International Academy of Oral Medicine and Toxicology, and they are the ones who are what I consider to be the most scientific. So they are bringing a protocol for all dentists to use, and you can become Smart Certified, safe mercury amalgam removal technique. And it is not difficult, but it does require you to be thinking in terms of not spreading the toxic material and keeping it confined, and also protecting yourself, the dentist, and the assistants. So that is a part of the International Academy, and they will help you become Smart Certified should you be a dentist would like to understand and learn that.